Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us.
And thanks again for joining us of another episode of the Keeping Ashland Healthy podcast. This is Executive Director of the Mental Health and Recovery Board, David Ross, and I am doing the episode solo. No Dr. Ashley today. She's taking a break, and I think it's because we had our big Mental Health and Recovery Board annual luncheon just a couple days ago on October 23rd. Recording this episode on the 25th, while it's still fresh in my mind, because as the Dr. Ashley will tell you, I'm getting older, and the memory's not what it used to be. So I wanted to get this on tape while it's still fresh. So I know we had several folks that could not attend the luncheon and wanted a recap, and that's my hope with today's episode, just to go over some of the major things discussed at the board's annual luncheon for those who missed it. And again, the Mental Health and Recovery Board made up of 12 volunteer members here in Ashland County community. In fact, if you're interested in some of our board members, we did individual Keeping Ashland Healthy podcast episodes on each one of them. And please look through our episode summaries and go through the list of all those past episodes, and you can listen to any of those. But if you're interested in the board members a little bit more in depth as we get to know them, you can do that. But 8 of the board members are appointed by our local county commissioners, and the other 4 by the Ohio Department of Mental Health and Addiction Services. And again, the main criteria is that they're all Ashland County residents and that they've got some tie to mental health and or substance use services, whether as somebody who's received services, maybe a son or daughter, relative has received services, or they're actually a practitioner themselves of mental health or substance use services. So there's this tie-in to the work, and they help us represent the county's needs, and how we go about meeting those needs is through that board process. And speaking of process, one of the things I discussed with the attendees in our program catalog was some of the changes that were made in fiscal year 2024, and that was the primary year under scrutiny during the luncheon. And fiscal year 24, we did some major things right at the beginning of the year in terms of board structure. There was an opportunity to reduce the size of the board from 18 members down to a lower number. The board chose 12. And that was important because it was becoming increasingly challenging to fill all 18 spots. I think the concept of having boards of directors, whether it's for-profits or not-for-profits or governmental entities, it's been around a long time. There's a tradition of that. However, it is getting harder and harder, if I'm being honest, to find individuals willing to serve on boards. We tried to find a number that made sense looking at our history and how many folks we've been able to historically attract to participate in the board. So the commissioners agreed with us, and we were able to switch that number to 12. And we still feel like we can represent the county efficiently and effectively that way. And also that will allow us not to have so many open slots on the board. One of the other things I covered in the year in review, reflections from my perspective, had to do with the number of meetings. That's another structural issue. The board made the decision to combine some of the planning and the fiscal together within our full board meeting, so we have a much more efficient, compact structure when it comes to our meetings. The board continues to meet monthly for the most part. We take 1 month off in the summer and another over the holiday season. But we continue to meet monthly and discuss the important work of the board and make decisions going forward on the needs, contracting, working with our local partners, including our contract partners, Appleseed, Catholic Charities, and Acada. The other thing I mentioned was events and training during fiscal year 24. We really had a robust year of trainings. The board has 3 signature events. Those are the luncheon, but also our RSVP and that stands for Respect, Success, Value, and Purpose, RSVP conference, and then our annual Suicide Prevention and Awareness Walk. All of those were very successful in fiscal year 24. And we're looking forward to good things in fiscal year 25. Another thing I mentioned in just big picture was the funding situation. Maybe not the most exciting thing folks want to hear about, but it is important to note that in Ohio, state funding has been flat for many, many years. And this is specifically the state funds, what we call the 421 allocation that comes to boards on a regular basis, has been very flat for many years, going on 15 years now. And that is increasingly causing challenges to programming. You might understand this personally, that the price of everything has gone up. Wages and salaries and benefits and bacon, all of those things have gone up, and it's been challenging to keep the high quality programs and services with essentially flat funding for the last 15 years. So I explained to the audience there really does need to be more advocacy with the state to see if we can't do better in increasing the amount of funds that are allocated to mental health and recovery boards like the ones around the state and in Ashland County. After some brief comments there, really the program spent a little time, everybody enjoying their lunch. And while they were doing that, we had Becca Smith, who is a music therapist with UH Samaritan. And Becca was doing a great job on the piano, and she was playing 80s tunes for me, which that, as Dr. Ashley will tell you, is one of my favorite genres is the 80s hair band. So Becca was kind enough to transpose those 80s hair bands into some tunes on the piano, and that kept the mood, I think, very light and fun, and I think folks like that. This is the first time we had done live music, so I'm hopeful that we can bring that back in the future. And special shout out to Becca Smith. Music and art therapy is something the board is spending more time emphasizing and focusing on. We think these are very effective methodologies for some folks that are struggling with substance use or emotional or mental health issues. They can express themselves that way, perhaps much easier than just strictly talk therapy or the verbal medium. So we broke for lunch, and folks from UA, University of Ashland Catering, did a wonderful job with the meal, and I think everybody had enough to eat. Of course, the boss did not eat since I was doing a lot of the talking, so I did miss out a little bit on that. After lunch, then we moved right into some brief updates that I made about some of the board's outcomes from fiscal year 24. I thought it was important that the audience and you all know, just how we did in some of our key programming areas. So we talked about our 24/7 crisis service, which I'm very, very passionate about. The board funds a 24/7 crisis helpline, warm line. We do that through Appleseed Community Mental Health Agency, and the 24/7 line is literally a lifeline for individuals that need it. We talked about in 2024, 1,683 calls that were made. 66% of those calls addressed what we would call emergent or crisis or de-escalation needs. So these are very severe situations where the person on the other end, either themselves or helping somebody else, needed that professional suggestions, advice, guidance to help them in that situation. And that sometimes that could be directing them to a local hospital ER. It could be other services that are necessary, just sometimes restore normal breathing with somebody who's having a difficult time just taking a normal breath. But then another 34% of those 1,683 calls were education, consultation, advocacy, and referral. And I pointed out to the audience, that's important to know that we want folks to call our 24/7 number, even if it's not an acute crisis situation. And what I mean by that is maybe you just don't know where to go. You're frustrated. You're afraid. You're not sure how to help yourself or a loved one. And you just need information. You just want to talk to somebody about what the options are and just talk through maybe what's going on with you. So that the 419-289-6111, that's the 24/7 number, you can do that. It doesn't have to be an acute crisis situation. It can be just I need more information. I'm worried about my son, my daughter, my husband, my wife, whomever it might be. So the 24/7 crisis hotline is staffed by local folks. Appleseed, these are trained folks. They understand the community. They understand the resources. I always mention that 988 is also available. That's a national call number. And the main difference, and the reason I promote our local over the national, is just that. The 988 is answered by somebody who's not local. It's a regional call center based out of another county. Their familiarity with our resources is not the same as our local number. So 988 is an option, but I do prefer our 24/7 local number, 419-289-6111. And next up, I talked about the school community liaison program. Easy for me to say. The school community liaison program is a hallmark program of the board. It has been for over 20 years. So most of the funds for this program come through the local levy. The board appreciates, and I can't say that enough, we appreciate the local levy and the local support we receive from Ashland County residents. This program is dynamic. It's unique, and it has been. In fact, I'm not aware of another county that's been able to stand up a similar program in their county like we've done all these years, because quite honestly, a lot of folks don't recognize the long-term and short-term impacts of this program, and they're just hesitant to spend so much of their levy because it does take quite a bit of resources to run a program like this, because the workers are in all the districts in a school, districts in the county, and the levy funds allow them to do their work in such a flexible way that they're not beholden to particular standards that would be required of a funder like, say, Medicaid. So young people don't need to sign up. They don't. Parents don't have to be somehow eligible financially. There is very little red tape, if you will, to qualify or to get involved with a liaison program. It's essentially as simple as if the young person, their family, the school folks that are concerned, they can reach out to the liaison. The liaison can immediately get to work trying to help. Folks always ask me, David, what do liaisons do? And quite frankly, they do whatever is needed in that situation. And that's the absolute magic of the program. It looks different in every building in the county, in the different districts. They really take on the needs and the cultures of the districts they're in, the buildings they're in. Stacy Merriweather she works at Appleseed. She's in charge of the liaison program. She's also the clinical director there at Appleseed. She's been the shepherd of that program, and shout out to Stacy. She's really made sure that program has remained at a high quality, effective level for, as I said, 20 plus years. In fiscal year 24, the program served over 2,250 unduplicated counts. So these are 2,250 students. Some of them were served more than once throughout the school year. Over 2,300 referrals were made for all types of things, not just for things like mental health or substance use help, but all, food, clothing, shelter, you name it. They made 2,334 referrals to community agencies with, and this is one of those astounding numbers, with a 92% follow-through rate. And what we mean by that is when the liaisons make these referrals, there's a 92% chance that the referral is followed through on. And that is because the liaisons often go with the individuals. They're working with them with that referral. They just don't give them a number or a name and say, here you go. They walk beside them as they get those helps. So again, it just makes that program so successful. Additionally, we've seen and continue to see great success with academic, behavioral issues, attendance issues. Those are the three major outcomes we track that the liaisons help that are school related. Again, over 80% improvements for those young people they're working with that are struggling with either behaviors, academic issues, and or attendance issues. Next, I moved on to summarize the drug alcohol prevention services that the board funds in our K through 12 schools, and again throughout the entire county, all the different districts. We've got, you might recall an episode we did back in the summer with what we call the Prevention Gals. We did that episode and featured all three of them, and they're in the buildings. Now four. We did hire another person because the need's been so great. But I just summarized the 2,241 hours of prevention services that were done in 2024, as well as the over 4,000 youth impacted. Next up, we talked about suicide prevention and awareness efforts in 2024. I mentioned the walk earlier, but we also talked about all the question, persuade, and refer. Question, persuade, refer is the board's primary approach to suicide prevention in the county. It has been now for about 17 years. And we did about 380 folks trained up as what we call a gatekeeper in the county. And similar to CPR, we've got folks trained that they can notice, they know what to look for, they know what to listen for when somebody might be struggling, and they learn how to ask the question. And that question basically is, are you feeling like taking your own life? Are you thinking about killing yourself? Are you thinking about suicide? So there's a couple different ways that we teach folks to try to ask that question. But the important thing is that they do ask that for somebody that they're concerned about. And we've done those trainings throughout the year, and we continue to do those in fiscal year 25 and beyond. As I say, over 380 folks trained last year. I think we've already surpassed that in fiscal year 25. But again, the more folks we have trained up in that model, the more likely we are to prevent even one suicide in the county, which is our goal. Next, I highlighted the Pathways Peer Support Program that is administered by Catholic Charities, Diocese of Cleveland. And again, this is a unique program in a lot of ways. The peer support program and peer support generally is on the rise throughout the state, I think in the country. So this is an adult peer program, so 18 and up, and folks are helped by folks that have been there, done that. They're now in a spot where they want to give back. So they had 77 new participants in fiscal year 24, and they do a lot of group work. Over 830 group sessions were offered in 24 with an average attendance of 9 folks, and a core group of about 13 participants every day. They meet at the professional building, which is downtown on 2nd Street and Church Street. If you're familiar with the county courthouse, right across the street from that. Pathways Peer Support Program. Get in touch with Catholic Charities if you're interested in joining that program, and Catholic Charities is 419-289-1903, and I'll try to drop in some of this information in our episode description for today's episode as well. Also, I mentioned our services at the jail, and these jail and community-based services are critical. I told the audience that with the nature of fentanyl and methamphetamine, we've seen a dramatic decrease in the amount of individuals that are presenting for treatment, substance use, mental health treatment generally, but particularly with substance use treatment on an outpatient basis. So the nature of fentanyl and methamphetamine use is such that they are less inclined to present at an outpatient agency like, say, an ACADA and say, hey, I need help with my fentanyl, or hey, I need help with my methamphetamine use. What's more likely to happen, and it's not just in Ashland County, but what is more likely to happen is an individual gets in trouble with law enforcement and ends up at a local jail. So in partnership with our sheriff and our jail folks, we've got very robust substance use and mental health services available to anyone there. And so we talk about over 600 and some hours of alcohol drug services at the jail during fiscal year 2024. A lot of that was in screening and education. A lot of assessments were done. 154 persons received either individual counseling or case management services. And then linkage services are also offered at our jail, and we had 227 persons receiving that. And what that means is, as the person is getting ready to exit the jail, especially if we've identified mental health and or substance use issues, we want to make sure that there's a plan already in place before they leave to get those follow-up services in the community. We want to prevent any kind of recidivism, which is a fancy word for coming back to the jail. We don't want that to happen. We want them to be able to get out of the jail, get the services they needed while they're in the jail, continue those when they're out in the community. Those could be mental health, drug, alcohol services, but they could be some of those basic services. Again, employment and education, housing, shelter, food, clothing, all these basic things. We want to try to arrange for those services before they leave the jail. So that's what jail community linkages services are all about. And again, we were very successful in terms of those served, and of those served, the ones that had no new arrest. At 190 out of those 227 had no new arrest. The other thing I mentioned lastly in my high-level report was the juvenile court liaison. This is an individual who works with 87 youth in fiscal year 24, as well as 8 adults. And the primary goal is to make sure that there's a good interface between our juvenile court, the juvenile probation officers, and community agencies, community partners, whether that's schools, other treating agencies. They also serve to help families negotiate some of these services, whether it's with the court or in the broader community. And I think the liaison has been instrumental in improving the relationship between the board, community partners, and the juvenile court. Every system has their own language, if you will, and having somebody that can stand between the various systems to help family and the individuals, the young people, we've seen a benefit over the years. So appreciative of all the youth and the families impacted positively by the liaison program. Last but not least, I just highlighted some of the fiscal receipts and expenditures from the board. I indicated to members that there's a little over $4.7 million in terms of a board budget. Not a big budget, actually. And I did point out that the board actually, our budget was a deficit budget for fiscal year 25, and all that means is that we allocated about $30,000 more than we anticipated bringing in revenues. And that goes back to what I said some minutes ago about the flat funding. We're trying to maintain all the high-quality services and also pay the folks that provide those services a living wage, and we're trying to be competitive with some of the surrounding counties so we don't lose quality people to some of these bigger counties. And that resulted, unfortunately, in a little bit of a deficit, which we were able to make up with some carryover funds from the previous year. But all that to say, it's important. I think that the community knows that the board is allocating the money that comes into it. The board is not a bank, as my old boss used to say. It is our job to allocate the funds that come in to those quality services that meet the needs of the Ashland County residents. And that's what the board is doing. Next up on the busy agenda was our keynote. And this year it was Judge Karen DeSanto Kellogg. DeSanto Kellogg was voted into office back in 2020, and she serves as our juvenile court as well as probate court judge. And I had the pleasure of introducing the judge, and she had been an attorney in private practice here in Ashland County and other counties, focused on family matters primarily. She's also served on various boards and committees in the county, including Appleseed and Advocates for Families, the old Parenting Plus. They updated their name, if you didn't know that. And Judge Kellogg, on a personal note, has been married to Brian, who's an attorney for 21 years, and they have 5 children. And the judge talked about that a little bit in her talk, which, I cannot do justice to her talk, but I will just say that the highlights for me had to do with the emphasis on the responsibility of a community to help our young people, to help the next generation. All of us have a responsibility to be parents, if you will. Obviously, the biological parents have a different responsibility to maybe family and friends in the broader community, but we all have a responsibility to help our young people be the best, most successful adults that they can be. So the judge really challenged us because she sees the young people that maybe there's not been enough support. There's not been enough rallying either by the biological parents or the extended family or the community, and these young people are struggling. So the judge really challenged the audience to help, to come alongside. If you're a parent, being a better parent. If your family and friends is coming alongside the biological parents, if you're in the community, be that positive person. One of the things that we often talk about is adverse childhood experiences in Ashland County, ACEs. That's some impactful, very important research that was done some years ago that says adverse childhood experiences can very much get in the way of young people being successful, and it can lead to all kinds of negative outcomes throughout the lifespan if they're not mitigated. And they can be mitigated in a variety of different ways. And what I mean by that is various things, even in spite of adverse childhood experiences. If there are other things going on, they can help lessen the impact of those negative events. And one of the primary things, people don't always think about this, one of the primary things that mitigates against adverse childhood experiences being as detrimental and long-lasting are positive adults. Consistent, caring, loving, dependable adults that are in the life of these young people. And again, this is why I think the judge's message was so powerful. All of us can be that to a young person, a teacher, a coach, somebody at church, a neighbor. There are opportunities for all of us to be that positive, caring, loving, supporting, dependable, reliable adult to a young person. So I think the judge's message was right on target to the extent we have strong families, we have strong young people, we have a strong up-and-coming generation. We're going to have a thriving, robust community. So shout out to Judge DeSanto Kellogg. I really thought her keynote this year was right on point, and she did a wonderful job in delivering it. From there, the home stretch of the luncheon had to do with 2 awards that we give out. The first is the Beacon Award, and the second is the Community Partnership Award. And this year's Beacon Award went to a long-time counselor, almost 40 years in our community. This counselor has been serving primarily the substance use disorder population at Acada. Her name is Mary Jo Jankar. Mary Jo, independently licensed counselor and social worker. In that 40 years, it's roughly, she's seen almost 8,000 folks over that time. Sometimes she's seen the person at various stages of their life. I mentioned in the presentation of the Beacon Award that it's not uncommon at all for individuals that are struggling with substance use to have multiple periods where they go through, they're successful, then they're not successful. Maybe they have a relapse or a slip. They drop out, and then they come back into treatment. And Mary Jo, like I think all the counselors at Acada, understand that. They explain that, and they let the person know if that does happen that they are welcome to return. There is no shame. There is no judgment if they come back to services 3, 4, 5 times, whatever it takes. We want the individuals to be successful in their recovery, and we know it usually just doesn't happen the first time. Oftentimes when I speak to groups, I ask them about weight loss and dieting, if they've ever done that in their life, or quitting smoking. think about it, there's a small percentage of individuals that wake up and say, I'm going to do this, and then they do it, and that's that. More often than not, it takes multiple times before we're successful in achieving our goals. No different than some of the substance use disorder folks that they're struggling. They don't succeed as well as they want the first time or the second time. So Mary Jo is oftentimes seen people many times throughout their lifetime until they get it right, until they get to the point where they feel like they finally are in recovery and are able to maintain that recovery. We did have a little fun at Mary Jo's expense, talking about some of her flamboyant dress styles, and I think some of the insiders I had at Akeda shared some stories that I thought brought some color into life into Mary Jo for the audience members. She just sometimes has a way of saying things that brings a lot of joy and laughter to the office. One of the things that I learned as I was getting this information together is just how much everybody enjoys working with Mary Jo over the years, even though some of the work that she has to do when doing some of these difficult assessments with folks that have a history of substance use, that's hard to be honest with somebody, be respectful, but also be blunt sometimes when you need to be blunt. Oftentimes when folks are struggling with substance use disorder, they don't want to be honest about their own use and some of the not side effects, but the effects, if you will, of that use. So Mary Jo had a way of doing that, being gentle but firm with folks when she needed to be that way. So, the Martha Jordan Beacon Award was actually established some years ago to honor Martha Phillips Jordan. Her legacy, Martha was kind of the county's counselor, if you will. She used to write columns in the Times Gazette back in the day. She worked with many folks in private practice and other capacities over the years, and she really had a love for this county and for the people in it. So the award was established by the board to just honor her, recognize other outstanding leaders in our community who reflect her work of supporting and caring for our fellow citizens who struggle with mental health and substance use issues by just helping them lead whole and independent lives. So we are proud to give the award, the Martha Jordan Beacon Award for 2024 to Mary Jo Jankar. So congratulations, Mary Jo. And last but not least, we had an award this year. First time we did this award, but it was important to the board that we recognize our partners. And the board cannot do its work effectively without partnerships, whether that's our contract partnerships with Akeda, Appleseed, or Catholic Charities, but also our community partnerships. And for the 2024 Community Partnership Award, we focused on the work in the partnership over the 20-plus years of Sheriff Wayne E. Reisner. So the Community Partnership Award recognizes outstanding organizations or individuals who have demonstrated exemplary leadership in the community by working together with all sectors, public, private, governmental, to ensure individuals and families with mental health substance use concerns receive the vital care they need to live productive lives. Effective partnerships are a cornerstone of strong communities. And as I was preparing to present the award to the sheriff, I had come across a quote that's attributed to Einstein that says, quote, "In the middle of every difficulty lies opportunity." The reason I thought that was fitting is as I think about the individuals in our local jail, that is a difficult situation for a lot of them, I would say most of them. But in the middle of that difficulty, I think there is opportunity, and that opportunity has really been made apparent to them through the work of the sheriff because he's been so open and encouraging and supportive of mental health and substance use services at the jail. And we really wanted to, as a board, recognize all those years of support that we've had. That is not a given. Not all sheriffs welcome the kind of robust services in their jail that our sheriff does. We wanted to recognize that. We wanted to recognize his ongoing advocacy for not only those services to the folks, the inmates there, but also his staff. We do a lot of ongoing staff training in mental health and substance use issues. They don't get a lot of that. The officers don't get that in the academy as they're coming up. So the sheriff believes strongly in training and education for his officers, and even self-care. When there was a spike in suicides and overdose deaths in the county in 2023, the sheriff reached out to myself and Jerry Strasbaugh, the executive director of Appleseed. He said, listen, we need to do something to take care of our guys. They have been exposed to a lot of these scenes, these deaths, and it's had an impact on them. So, what can we do to help them? What tools and abilities and skills, information can we provide to them to help them as they're dealing with all these losses? So we did that in 2023, and that's just the kind of sheriff he is. He cares about his folks. He cares about the people that are at the jail. He cares about the visitors that come down and offer services. He will not allow services to be delivered at the jail if they're not done in a professional, quality way. He holds everyone there, the individuals, the staff, and any visitors to a very high level, and we appreciate that about the sheriff. It's that consistent professionalism, high expectations that makes our jail, I think, one of the best. When other people come to the county, I let the audience know, I hear the same thing. Every time people come that haven't been to Ashland County before, they remark on the robust services. They just can't believe how many services we have in our jail and the culture that the sheriff has created. So one of the things I said to the audience was that, I can't think of a better testament to an effective leader than when they leave, when they exit an organization via retirement or any other way, that the culture, the initiatives, their impact lives on after them, after they've left, so that if someone were to walk into that organization years after that they've departed, that many of if not all of their initiatives and the culture that they created lives on after them. I think that just speaks volumes. And as the sheriff is planning to retire in January of 2025, I am confident that the legacy that he's established will outlive him. It will go on to years to come, and I have had some preliminary discussions with the incoming sheriff, Kurt Schneider, and I believe he is on board, and we will have that ongoing partnership with the new sheriff that we've had with Sheriff Wayne E. Reisner. But we will miss him, and we just wanted to honor him with the Community Partnership Award before he retired in January. So that was it. We had some picture opportunities. So for those of you that could not make the luncheon in person, I hope this gives you some sense of what happened at the lunch. The full annual report is available at our website, www.ashlandmhrb.org. And you can, I summarized it, so there's way more information in it. So we encourage you to go out to the website and download that. Again, I'll drop some additional information into the podcast episode from today. But I hope that you'll join us next year for the annual luncheon. We do this every year in October, so be looking for that. But we'll have plenty of opportunities to invite you to other events and activities and trainings throughout state fiscal year 2025. Thanks again.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.